Happy HBK Wellness Wednesday, everyone. Master T-Tap trainer Kiona Leah and wellness enthusiast back with you guys again for another of our Wellness Wednesdays. Now this week we are talking about low impact lymph moves on our channel because I had one of my students ask me when she wasn't feeling very well what she could do to get that lymph moving. Now, within our postural restoration system that we use, we talk a lot about breathing and how as we really truly expand the ribs, the upper part of the ribs, and allow the hips to move as they naturally would, we've got these three, the main diaphragm that we're all aware of here in the center. There's another set, the pelvic floor diaphragm, of muscles that move similarly, and around our clavicles we have another set of muscles that move similarly up and down, doming and flattening to give us a lot of lymph circulation through the body, 80% of which is in this upper chest on the left-hand side. So this all relates very, very, very well to breathing. Dr. Andrew Huberman, you guys know how in love with that man I am, did an amazing podcast last week about balancing estrogen and testosterone and had a very short segment on breathing in particular. He started out talking about apnea, most primarily sleep apnea, which is, of course, when people stop breathing in the middle of the night primarily, but not all the time. Some people will do it during the day as well. And how one of the things that he likes to call the physiological sigh, the 2 inhales, 1 exhale, as I like to say it, is how people actually recover from that. It brings a lot more oxygen into the body. It also downregulates our autonomic nervous system and allows us to recover faster. He then went on to talk about what I'm going to talk about a little bit more today, and that is nasal breathing. Now, I know we have all been stuck in masks for over a year at this point. And unfortunately, even with all the vaccines rolling out, people getting vaccinated all over the place, those are not going away because it still seems to be one of the best ways to prevent infection and lower viral load, especially to keep those who cannot be vaccinated for one reason or another safe as we sort of reach this herd immunity and learn more, which means we're still stuck in these masks. One of the things that I definitely have always noticed when I wear a mask is I tend to breathe through my mouth. I'm already struggling to bring in a bunch of air, so I open my mouth to try and make that easier. It actually doesn't really help. There have been some studies that have shown that if they put exercisers, people who are running on treadmills, so they're huffing and puffing, and our natural tendency is to then open our mouths and breathe, they are not actually finding in some studies, not all, there hasn't been a conclusive evidence, but there is evidence that suggests that breathing through your mouth does not actually benefit you or give you any additional oxygen in your blood. And that's where we really, really, really need it versus nasal breathing. But nasal breathing has a lot of other benefits to it. First and foremost, because I know that we talk about this and we've talked about taking a good picture and we always want to look good with our crown on, there are some major cosmetic changes that happen when we habitually breathe through our mouth. Let's look at this a little bit more, and I'm going to give you guys a profile view. I'll turn this way so my mic's not in your way. If I open my mouth to breathe, what's one of the first things you notice? If I close my mouth, now, if I open my mouth, what happened? My chin just pulled back. I'm pulling back my chin in order to open my mouth. I don't open my mouth with my chin thrust forward. Part of what happens as the jaw hinges and comes in, it goes up and slightly forward. So as we open and go back, habitually over time, this face position causes our chin to stay back there. Did you ever notice how your grandma didn't have a chin or your grandpa didn't have a chin? Now you might understand a little bit of why. So keeping the mouth closed, especially when we're sleeping, which is how often have we seen somebody doing this? Right? Especially keeping that mouth closed can really benefit and keep those facial muscles and facial bones where they belong. In addition to that, what happens when I do this? I'm also lengthening my whole face, stretching out this space right here, which is going to pull my eyes down, possibly cause them to droop. All these things we actually start seeing when people age. We're going to accelerate that just by breathing through our mouth. So if that's not reason enough for anybody else out there who's as vain as yours truly to keep your mouth shut, I don't know what is. But there's a lot more amazing health benefits to breathing through our nose instead. Number one, it slows our breathing down. Because of the fact that you are going through the smaller area, you inhale for longer, which is actually good for what? Stress. What's one of the first things they say to do? Take a deep breath. Even while exercising, if you close your mouth, and I have been practicing this since last week, it's not easy when you're exercising in a mask, let me tell you, but it is completely doable. It makes a big difference. It slows down your breathing, and that was one of the things that they found in the study that showed there was no difference in oxygenation levels, is the fact that the nose breather had their mouth closed, so they breathe slower. They're pulling in just as much air and as much oxygen in the same amount of time overall, but in fewer breaths. So it overall slows our respiratory rate down, which is going to reduce our stress levels. One of the other major benefits that we have from this is the air entering the lungs is 40% warmer on a cold day, for those that live in those cold climates, than breathing through the mouth. That's also why sometimes it hurts when it's super cold to breathe through your nose, because all of a sudden, whoop, all those little nose hairs and all that extra moisture that does that, freezes up and doesn't feel very good. Totally understand. That's why I'm a huge advocate of a scarf, by the way, because that helps as well. But it also shows that it adds that moisture, which I just talked about as well. So you get moist, warm air entering the lungs. That they process significantly better than cold, dry air. You get more oxygen out of that as well as a result of that. And one of my very favorite things when I looked this up on Healthline was that part of the mechanism of breathing through the nose is, as you do that, the structure of the nose helps the body help itself with nitric oxide. Now, nitric oxide release helps vasodilate, which means your blood vessels increase in size. This may actually explain why studies are showing nasal breathing increases your oxygen content in the blood. If the veins are bigger that are bringing that oxygenated blood to the rest of the body, you're going to be able to have more of it. And here's the thing. How many people may or may not have heard of nitric oxide supplementation? For those that struggle with circulation in particular, you may have to spend money on something like this. And this is not cheap, I can tell you that, because I have to buy it on something like this to keep things like tinnitus or arthritis, cold hands, whatever, at bay. For me personally, I went on this when my ears started ringing. But if I can just close my dang mouth, you guys know how much I love to do that, and just breathe, I may be able to use less of this, which saves me money and hassle, because you know how often I forget to actually take that? It has to be, this one in particular, it's a very high-end product, has to be refrigerated, so then I have to remember to take it out of the fridge and take it, it's liquid, obviously, so I gotta take it separately. It tastes disgusting, so unlike some of my other supplements that I'll just throw in my water to drink all day and not think about, can't do that with this. It needs its own special little snowflake time that I have to take it. It's a pain in the butt. So for me, the benefit of learning to breathe through my nose as much as possible has a lot of extra benefits to it, not just those cosmetic ones about my vanity. In addition, the other thing that hormonal studies are showing is that that slower breathing and that deeper breathing also helps us get into better rest all around. It will actually start to reduce the amount of apnea that you have overnight, even if you're obviously not awake to think about keeping that mouth shut. Some people are practice mouth taping. I'm not going to advocate for that. I personally, you guys know, I never tell you to do anything that I wouldn't do. I personally would not trust something like tape over my lips on a regular basis because They tend to get scratched, irritated. This is very, very, very soft, thin skin. Something like maybe one of those little chin strap things that comes over your head and holds your chin up might be something more like what I would think about, but I definitely would not tape my mouth shut. I just wouldn't do it. So I'm not going to tell you guys to do it. If you do and you have good results, let us know and comment below. I'm not going to argue with you. I just am much in integrity as I can be with you guys to never recommend something I personally wouldn't do. Or I'll tell you why I wouldn't do it, and I just did. So that is another one. What that nice deep breathing does, and getting into that sleep cycle in a better, more effective manner does, is it drops cortisol. So for those of you that are always concerned about that belly, here's another reason to practice this. Dropping cortisol then allows the body to better and more effectively make your testosterone and estrogen, depending on which one you need. Technically, we all need both, but what ratio? Getting those ratios correct, which can really help us with our exercise and fitness goals as well. So all around, a fantastic, fantastic way to really work at that. But here's a little trick from PRI that I just love. Helps unwind and unlock the cranium and helps teach us to do this breathing. We're going to do alternate nostril breathing. So what we're going to do is we're going to close one nostril down. Inhale. Both nostrils and hold for a second, and then open the other nostril and exhale through the nostril. Holding again for just a second. Inhale through that same nostril. Close it down. Hold for a second. Open the first one. Exhale. Hold for a second. Inhale that side. Close it down for just a second. Open the second side. Exhaling, then hold for a second. Inhale that side. Close it down, hold for a second. Open, exhale. Hold for a second. That was 3. We're doing 5. Inhale. Close it down, hold for a second. Open the other side, exhale. Hold for a second. Inhale. Close it down, hold for a second. Open the first side, exhale. And here's our very last one. Inhale. Close for a second. Open the other side, exhale. And release. Do you feel a shift in your head? You might feel more open. Remember, breathing through the nose shifts all of those bones and muscles in your face. Alternating makes it even more so and helps open up those sinuses. So you may notice a difference. And boy, it didn't feel that way when you were doing it. But once you get both nostrils back, you can really feel a difference. Might be something to try just before bed. Again, comment and let me know how it goes if you try it. All right, you guys. So that is our HBK Wellness Wednesday. All kinds of cool stuff on nostril breathing and maybe how to get yourself started on it. I want to hear from you if you notice a difference. I know I am, and I'm starting to notice a difference in my sleep as well. What else do you guys want to talk about? I'm always looking for topics, so make sure and comment below. Always means so much to me when I see that you like and share my videos. It makes my day. In the meantime, I'm Kiona Leah. I want to see you move, live, and thrive. So I'll see you on the next one.